I'll be proposing in the next 2 weeks a national defense electronic health system. Now, all of you watched recently as New Orleans was evacuated on the interstate highway. All of you watched recently as Galveston was evacuated on the interstate highway. They were existing because in 1955, President Eisenhower proposed the National Defense Interstate Highway Act in order to evacuate cities in case of a nuclear war, and said, by the way, this is a dual-use system. In between nuclear wars, go ahead and use it. We lost 1,100,000 paper records in Katrina and learned nothing. And the time has come to cut the bullet, to bite the bullet, just get it done. And so here's the proposition. By December 2012, we should have a paperless electronic health system. That is, in fact, 51 months from now. That is 7 months longer than the entire Second World War in the American experience. From the time the Japanese attacked us on December 7th, 1941, to the defeat of Japan in August of 1945, is 3 years and 8 months. Because we were serious. Now, if we're serious, we can easily have 100% involvement in an electronic health system by December 2012. And by the way, if we're not serious, we may not have it by 2020. More time isn't going to help you. It's just going to give you more time to fight. Now, how do you pay for it? I want to offer you a very bold, this also requires changing the Budget Act, which I am absolutely determined to destroy because it is one of the most difficult problems that's stopping America from moving into the future. It's utterly an insane bill. Very simple model. TSIS, which is a member of the Center for Health Transformation, is one of the 2 largest credit card backroom operations in the United States, Visa, MasterCard, American Express. By using electronic systems with expert supervision, the expert overlay tracks in real time any effort at fraud, and their fraud rate is less than 0.2%. Paper-based systems are ideal for crooks because you never catch up with them. So the New York Times estimates that in New York State's Medicaid program, over 10% is pure fraud. Now, let me understand, by pure fraud I mean 982 procedures a day by a dentist. I mean a dental office in Brooklyn which had a person stand out front who said, if you'll loan me your Medicaid card, I will give you a free DVD player. I mean, we're not talking here about judgment calls. Carrie Weems, the current director of CMS, said to me this morning, they tracked down one guy who had filed for 4 colonoscopies on one person in the same day. Those of you old enough to have experienced that can think later on about the implication. One hopes that that is fraud and wasn't actually. So what are we talking about? Let's assume that being government, we can only be 1/10 as effective as TSIS, so we'll have a 2% error rate. That means in New York State alone, we save $3.9 billion a year. I would write the bill to put every dollar saved in fraud into a trust fund. The first thing the trust fund would do is pay for an electronic health system for the country. The second thing it would do is pay for the uninsured to have tax credits and vouchers so we can mop up the uninsured. And my prediction is, within 4 years of an electronic health system, the trust fund has so much money that we have covered every single person in the United States, and we are in the process of giving some back to the taxpayer as a benefit. That's a totally different model. It's in my judgment, totally defensible, and vastly better than the mess we're in right now.